Smallpox. Just like the 2019 coronavirus, smallpox is a viral infection that spreads from person to person through respiratory droplets or direct contact with the infected person or objects. It is believed to have existed for at least 3,000 years, and in the entire history of humankind, smallpox has killed more people than all other infectious diseases combined. The symptoms of smallpox include high fever, a rash of blisters covering the entire body, and abdominal pain. Almost 300 to 500 million people have lost their lives to this deadly disease. And in the 18th century, it alone killed 30% of those infected in Europe, mostly babies. Luckily, smallpox was last naturally endemic in 1977, and since then, it has been eradicated through a worldwide vaccination effort. Bubonic plague. The bubonic plague, also known as the Black Death, is the most common type of plague caused by the bite of an infected flea. If you were a medieval peasant back in Europe, you would have a 2 in 3 chance of being one of the 200 million it killed. An irritating rat might settle down for a nap on your straw bed, and within a week, you'd be the new victim of this zoonotic disease as you experience extremely painful symptoms, including severe fatigue, high fever, and swollen, blackened lymph nodes. Without antibiotics, over 70% of people who contracted the Black Plague didn't survive. It wiped out the whole town and spread so rapidly that the death toll was so high that there weren't enough people left to bury all the bodies. Ebola. The Ebola virus is a very deadly and horrifying disease known for its excruciating symptoms, like bleeding from various organs. This virus attacks the body's vascular and immune systems, which leads to overall damage. People usually experience symptoms like fever, fatigue, muscle pain, and severe headaches before progressing to the advanced stage. For instance, in 2014, a man who unknowingly ate contaminated meat later suffered from hemorrhagic fever that caused bleeding from his eyes, nose, and gums. This happens because it damages the blood vessels, and the body's extreme response further worsens the condition. With a current mortality rate of 90%, Ebola is one of the deadliest diseases in the world, meaning 9 out of 10 individuals will die. Tuberculosis. Tuberculosis is a deadly disease that primarily attacks the lungs. It is caused by Mycobacterium tuberculosis, which spreads through the air when a person coughs or sneezes. Imagine it's 1890, and you're struck by a relentless cough, intense chest pain, and overwhelming fatigue. As the disease progresses, you begin coughing up blood and battling high fevers and night sweats. The bacteria slowly destroy your lungs, leaving them riddled with holes like Swiss cheese. Without today's 6-month treatment, your chances of survival would be slim, with a 60% mortality rate. Malaria. Malaria is a life-threatening disease that is caused by a parasite transferred through the bite of infected mosquitoes. Once in the body, the parasite quickly travels to the liver, multiplies, and invades red blood cells, leading to their destruction. Symptoms, which typically appear within 5 to 10 days, include fever, chills, and fatigue. Malaria is so effective at invading and killing blood cells that scientists have stumbled to find a way to vacate the parasite without harming the body. It can also cause confusion and anemia due to the extensive destruction of red blood cells. If left untreated, malaria can lead to severe issues such as respiratory distress, brain damage, and death. Polio. While not a serious subject can be understood through an analogy, picture your body as a fortress with your spinal cord as the internal security system. Polio is like a virus hacker that infiltrates your defense system, which causes lifelong paralysis or even death. It especially affects children under the age of 5, attacking nerve cells and causing permanent muscle weakness and paralysis. However, thanks to the advent of vaccines, polio has been successfully eradicated from most countries and is on track to be completely eliminated globally. Anthrax. Anthrax is a serious bacterial infection induced by Bacillus anthracis, a spore-forming bacterium. It can also be used in war as a biological weapon. The most severe type, inhalation anthrax, occurs when spores are breathed in, leading to intense respiratory distress. Once inside the lungs, the bacteria spread rapidly through the bloodstream, taking shelter in white blood cells and exploiting them for survival. This creates a vicious cycle where the bacteria destroy cells to fuel their growth until death. While most cases are linked to animals, the spores can survive for years. Leprosy. Leprosy is caused by a bacterium known as Mycobacterium leprae. It typically begins with pale or reddish patches on the skin that are numb to the touch. If left untreated, it can result in significant nerve damage, skin lesions, muscle weakness, and paralysis. Over time, affected individuals may experience the loss of fingers, toes, and even the nose, leading to permanent disfigurement. Contrary to typical fantasies, leprosy is transmitted only through prolonged close contact with an untreated person and is not highly contagious. Historically, those afflicted with leprosy faced social stigma and were isolated in colonies due to overall fear of transmission. Tetanus. Tetanus is a perilous infection caused by Clostridium tetani, commonly found in soil, dust, and animal waste. It typically enters the body through open cuts and wounds. If you sting yourself with a rusty nail, you might not even acknowledge that tetanus bacteria have driven their way in. Once inside, the bacteria produce a toxin that disrupts nerve signals, leading to severe muscle rigidity and painful spasms, especially in the jaw and neck area, a condition often referred to as lockjaw. If not treated promptly, tetanus can lead to very serious complications and even death. Mad cow disease. Mad cow disease, or bovine spongiform encephalopathy, BSE, is a rare and serious condition that affects cattle and can be transmitted to humans through contaminated meat. Picture a peaceful field of cows, where suddenly one begins to show strange behavior. This disease is caused by misfolded proteins called prions that create sponge-like holes in the brain, causing erratic and aggressive behavior in the infected cows. If humans consume meat from these diseased animals, the prions can invade their brains, leading to variant Creutzfeldt-Jakob disease, a severe and fatal neurodegenerative disorder. Rabies. You must have watched many videos on the internet of cute and friendly animals like raccoons, dogs, and foxes behaving oddly or aggressively. That's because these animals are infected with rabies. Rabies is a viral disease that affects the nervous system and causes animals and humans to behave erratically and aggressively. On Earth, it's the most lethal zoonotic disease. The virus spreads through the saliva of infected animals and is usually transmitted to humans when bitten by an infected animal. Symptoms of rabies include fear of water, hallucinations, and violent behavior. Once symptoms appear, rabies has a nearly 100% fatality rate, which makes it one of the deadliest diseases known to man. Cholera. Cholera is a severe bacterial infection characterized by the sudden onset of intense diarrhea and dehydration, which can become fatal within 24 hours if not treated swiftly. The bacteria responsible, often found in contaminated water or food in areas with poor sanitation, release a potent toxin once ingested. This toxin triggers massive watery diarrhea, vomiting, and painful leg cramps. The rapid loss of fluids can lead to severe dehydration, and even extensive rehydration efforts may be insufficient to counteract the effects of the toxin. Prompt medical intervention is crucial to manage symptoms and prevent a tragic outcome. Brain-eating amoeba. Naegleria fowleri, also known as the brain-eating amoeba, is a microscopic organism that is found in warm freshwater, such as ponds and lakes. Imagine a hot summer day, and you decide to go for a dip in a pond, but little did you know that you came in contact with this deadly amoeba. It enters your body through the nose, and from there, it travels to your brain. Once there, it starts to feed on your brain cells, causing a severe infection. Symptoms of this infection include severe headaches, nausea, fever, and a stiff neck. Unfortunately, it is a swift infection, and most people who contract it do not survive.